Um, so another thing about blood sugar monitoring, you're going to be asking for 2 checks a day. It is totally okay for you to ask for more if you need more to make a different decision. So if they're taking fast-acting insulin with their meals and you think there's maybe a problem there that you're not able to discover, you want more information, ask for a 2-hour after meal check, a few times a week, or ask for a pre-dinner check rather than a nighttime check, or both. More is always better in my imagination. Don't be afraid to do that. And if they don't have enough strips, talk to me, and I'll grab an endocrinologist or somebody, and we'll get it changed so that the amount that they get is correct, so they can actually do that. So hypoglycemia. So you may be the person that reminds them of how to treat hypoglycemia if they're not fully aware of what that is. I have actually had somebody come in and tell me that when they're hypoglycemic, they need to take more insulin. And that could be very, very dangerous. And we did go over that many times. That actually means you need more sugar. So, reminding people, there's a rule of 15. So you check your blood sugar, you're hypoglycemic, you take 15 grams of carb. And I always encourage people to, buy these little prepackaged Dex4 fast-acting glucose things at CVS or wherever. You can also get glucose tabs, which obviously I carry in bulk, and for emergencies. Or you can get the little Juicy Juice box for the kids. Not the full-size box, but the little box is 16 grams of carb. The small pack of crackers, the 4-pack, not the 6-pack. 4-pack will do. And if it's got peanut butter in it, it won't react as fast, but it'll still help. So again, keep in mind that fat is going to slow down everything. So when you're doing trying to correct something like a low blood glucose, you want something that it doesn't have fat in it if you can avoid it. You can always follow up with a protein later if you want to try to stabilize glucose. With type 1s, that usually helps them if you can stabilize them with 15 grams and then eat something with protein like peanuts or a string cheese, a little package of string cheese or something will help even them out and keep them from bottoming out again over several hours. You'll also run into people who want to, the phenomenon I call it is eat the fridge. So when you're low, your body is like, I need food, I need it now, and I need to eat everything. And I have been there. I've been on the floor eating like things out of the cabinet, being like, I have to get my blood sugar back up. And then you're 400. So it's really ineffective. But that is the instinct. It's like, I am in danger. I'm in serious danger. I gotta eat everything. And they may feel that at 80 if they've been hanging out at 300 for several days. So to talk to them about what real hypoglycemia is, and that if they're hanging out at 80, they feel really like they're bottoming out, just eat a little bit of something, check it again in 15 minutes. If they're still low, correct it. There's sort of this false hypoglycemia that can happen when people have been hanging out too high too long. And so, even 120 can feel low if you've been hanging out at 300. If they're complaining of hypoglycemia at 120, just, remind them, because your body's not been there in a while, and you're just readjusting to what normal feels like. And it's important to not overtreat that low. I know I've done it myself, but you can overtreat a low and then be chasing a high the rest of the day. Being active, encouraging activity. So if you're talking to someone and you only have 15 minutes with them, but like they have a dog, or something about them, that they have grandkids or something, talk to them about how maybe they can get involved with that. Maybe they walk the dog twice a day. Maybe they play with their kids or grandkids in the yard. There's actually a really cool volunteer program the ASPCA has for people who want to walk dogs. You can volunteer to walk dogs several days a week for all the homeless pets. And that's a very cool volunteer activity. A lot of our people I've talked into doing that. And they feel obligated, so they do go, they do walk, and then they feel like they've done something that's not like being punished exercise. Because some people feel like exercise is like punishment. That's not their thing, they don't like it. So finding a cool or new way to do something that, you know, if it's just take the stairs instead of the elevator, or wear a pedometer, try to walk a little bit more. Anything you can do to kind of encourage activity will be great. Taking medication. So some people, believe it or not, forget to take their medication. And some of them forget to take their insulin. So troubleshoot with them on how to remember. Is there something they do every day that they could pair that activity with? You know, do they brush their teeth at a certain time of day? Well, maybe they could brush their teeth and give their insulin and take their pills. Or, you know, maybe it's when they take a shower. Oh, before I take a shower, I needed to do my medicine. Or maybe they have a smartphone. You can set up alerts, you know, repeated alerts. Did I, you know, take medication? Here's a little bell. Take medication. Did you take your insulin? Anything you can think of to kind of make that easier for them to remember. Because you don't want to let it slide, because it'll happen week after week. And then you've got someone with some serious high blood sugar. And sometimes they actually just want to know why they need to take the medication. So I actually had somebody who wasn't taking their metformin, and she thought it was because it was gonna, it was something about she thought she was taking it to give her diarrhea to lose weight or something was going to happen, and she wasn't really sure. And yes, diarrhea is a side effect of metformin early on until you get used to it, but it's actually for her blood sugar. And then once she understood it was for her blood sugar, she was fine, and she started taking it again. So sometimes just understanding why you're taking a medication is important. Problem solving. So I have an example here. So Nancy is a 43-year-old African-American female, type 2 diabetes for 6 years. She has a BMI of 35. She has high blood pressure and an A1C of 9.3. She takes 52 units of Lantus in the morning when she remembers, and metformin a lot of the time. When asked about what she likes to do for exercise, she says that she can't go outside and walk like she wants to because of the bothersome people in her neighborhood. So given this information, how would you engage Nancy to correct the behaviors of not taking the medication and get active or attempt activity? So this is your patient. You're on a 15-minute phone call. What do you do?
I'm going to ask her if there's any nice parks near where she lives where maybe she could go to the park and walk instead of her neighborhood.
Great. And don't engage on the bothersome people thing, because that'll go, like, forever. Like, we don't care what that is. We don't care what that is. Just, you skim over it. Exactly. Go to the solution. Yep. That's good. Anything else? How do you get her to take her meds?
I might ask her, like, why she's not taking her meds. Like, does she think they're effective? Does she know what they're used for?
Right.
And then you can ask about routine, what you were just talking about. She has for routines.
Exactly. And then the third question that I forgot to mention is, does she actually have her medication? So I have run into the people who haven't been taking their medication is because they didn't refill it. So that's another question. It seems obvious, but sometimes some people just, they don't refill it and they're out. And that's why they're not taking it. Or they're splitting pills or taking them every other day or something like that. Okay, good. So healthy coping, I want to touch on that. Being diagnosed with a chronic illness is no picnic for anybody. And they're going to go through, you know, all the stages of grief. You know, being angry and denying it and being really mad, and eventually they accept it. But they may actually, you know, it's a kind of a pendulum. They may actually swing back and forth through that many times before they come to acceptance. And they still may go back through it because you don't get to get rid of it. You know, it's there. Yes, you can reverse some of type 2 diabetes, but in general, with the patients population you're going to be working with, that's going to be a very rare occurrence. You may be able to get them even like on a much less dose of insulin, which would be great, but you're probably not going to be able to reverse it. So being sympathetic to the fact that it is a major pain in the butt, and that it does ask a lot of them, and being very encouraging of the behavior that you see that is good.